Hello everyone, we hope you're doing well today. Today we're going to be looking or observing Ernie's appointment where he's going to be receiving some cold laser and vitamin B12 injections, also called acupuncture, because Dr. Beth actually injects the B12 and zeal into acupuncture points to help stimulate them. And here we are.
All right. So Ernie is the best. He's a little bit shy, but we're very proud of him because he's adjusted to our curbside routine really well. So he has a bunch of arthritis, and he has had surgery for his knee before. And so we're trying to find ways for him to help to reduce inflammation and pain in his joints. And also to stimulate his body to have the best musculoskeletal strength and immune system that he can have. Because he is a shy guy, and he'd rather not be in here for too long, we went from doing some cold laser and acupuncture treatments for when we were doing our regular service. When COVID struck, we changed to acupuncture so that he doesn't have to wait as long. And so we use acupuncture a bunch to augment our treatments, but in many patients, but sometimes we'll use it as a substitute for those patients that don't like sitting with the needles, or if the needles bother them. So what we do, I'm just going to do my little exam. Hi, handsome. So looking at his mouth and his tongue and his eyes and his ears. So what happens with the acupuncture is, instead of placing a needle, good job. Instead of placing an acupuncture needle in that spot, in that acupuncture point that we've decided needs to be stimulated, we put a little solution in there, and it can be anything. Many veterinary acupuncturists will tend to use B12 because it has a lot of nice properties. Here, now we're seeing some of his shyness. I'm not going to bother him with that, but I am going to insist on looking in your ears. So B12 is very nice for the gastrointestinal system, and it is also really good for kind of giving the body a boost in many ways. No, I'm not going to be too mean about this, but I do want to just take a peek, sir. Good job. And often we'll either dilute that vitamin B12 out with some saline, or I use, as Sam mentioned, something called zeal, which is a homeopathic solution that is really nice for pain and arthritis. And so I started using it in combination and just really find it's nice. The only thing that can be hard about B12 injections is that they can cause a little bit of a pink tinge in the urine, which can be very alarming and look like blood, but it's not. So it's not actually a problem. We just have to make sure everyone is aware. Most noted in the winter time, right, Ernie? When it's snowy out and we can see these things. And I'm just giving him some motion palpation in his spine. Because he has some pretty significant arthritis in his forelegs, he does a lot of work with his spine and a lot of work with, throughout his whole spine. So I try to give him a little relief while he's here. And that's actually where we use the acupuncture points. Good job. And as you can see, he is so good. He is so good. Who'd you see out there? Just give everything a little listen and make sure nothing has changed. It's just, I don't know, that's hard.
We often refer to Ernie as the polar bear because of his white floofiness and bear-like qualities.
He's so handsome. He is a really good sport. He has a great family at home, some dog companions that are younger than him, that he's very tolerant of, and he's just a really good big brother. All right. So when I do aquapuncture, different vets do it in different ways, but I use a small needle, but not the smallest needle that I can find, but smaller than we would use for a typical injection or to draw blood or anything like that. And then what I do is I find my acupuncture point. This one is on the governing vessel, which is a meridian that goes the length of the spine from the tip of the head. Pop it in there. And then I'm going to inject probably about a half of a cc. And then that's it. And you can see he doesn't really mind it very much. Sometimes there are animals that it's a little bit twingy, and with him, he will sometimes react a little bit more in certain places. If I put an injection in one of his trigger points, like he has some muscle tension in this area, he might be a little bit more reactive. But again, for Ernie, the priority is, there's a little twinge. The priority is to get him in and out pretty fast, stimulate those acupuncture points that we're looking to stimulate. This point that I'm in right now is actually a liver point, and the liver in Chinese medicine influences the blood, and the blood gets kind of thought of as stuck in different places in arthritis. It can also be a place where stress is held. For him, I don't think Ernie is very stressed in his everyday life. I think it's more the vet visits that are tough. But clearly he's a good sport. But so I'm going, because he's a pretty big guy, I'm going pretty deep in there, and you can see it doesn't bug him very much. And like I said, we use this a lot in cats. Another animal that is very responsive to aquapuncture, and sometimes will prefer not to sit with needles, depending on the cat. I'm also going to do a kidney point back here, which is really good for the bones, and also because I know by the way he walks, that's a good trigger point, so you can kind of see him react a little bit. Then I go in, he loosens up, I do my injection, and that's it. And I change the needle every time, just to make sure it's nice and clean. And then this is probably going to be our last one, and then we'll do some of his laser therapy. She also does really well for. He always sits with this knee up, which is great because that's the one that I want to treat today. And I'm also going to treat his forelegs too, so his elbows. And that's it for his acupuncture.
Good job, Ernie.
It's like, I'm the best. I'm the best. We actually met Ernie because we saw his brother first, who had a whole different challenge. And then we finally got to meet this guy. Right, buddy? I think that's it, Sam, unless you have any questions.
Yeah, if you just want to tell people what the cold laser is doing for him, and then I think we can
We'll
wrap it up.
So the cold laser I'm using for him, I'm going to treat probably this area in his lumbosacral space, maybe a little bit around his hips, this knee, which he has problems with. He's got some arthritis in his elbows, so we'll probably treat those as well. I often will do kind of the base of his cervical spine too, because that just does so much work with that big, giant, beautiful head, and being a little bit off with his gait because of his arthritis. His spine does a lot of work. And then we'll use the laser to also stimulate the acupuncture points, but using light instead of pressure to reduce inflammation and tell the body to reduce some of the pain messages from getting up to the brain, and kind of ask the body to create more healthy, good blood supply to the local area. And as you can see, he's panting a little bit because it's super hot today, even with our air conditioning. And but it's not anything uncomfortable for him. I don't want you to eat that fuzz bunny by accident of your own business, sir. But I think he tolerates it really well. If animals do not like the feel of cold laser, usually they will keep, and this is true for needles too, but they'll keep looking at that area, trying to tell us that it's really not comfortable and maybe it feels a little bit funny, and then we'll choose a different pack for their treatment.
Yep.
I think that's it. If anybody has any questions or anything they'd like to see us talk about, let us know in the comment section. And our beloved nurse Sam will be doing a Facebook Live next Monday on the benefits of craniosacral therapy that she is currently studying. All right, have a good day and stay cool, everybody.